Ladies and gentlemen, I have to apologize because whenever I was doing part 1 of the review for Module 5, I came to a point where I needed to cough, and I accidentally ended that audio cast instead of just pausing it, so I couldn't figure out how to add on to it. So we were just about finished with the information regarding tricyclic antidepressants, but these are the interventions based on how the medicine works and the side effects. Obviously, always assessing mood, suicidal thoughts, or whatever else the medication is being given for. If it's being given for bedwetting or pain management, whatever, you are going to assess that. But you always are still going to assess mood and suicidal thoughts, even if it's being used to help with sleep or anything else. Secondly, assessing blood pressure and pulse prior to initiating therapy or giving the medication, and periodically thereafter. Assessing EKG, particularly for that high-risk group of the elderly, anyone with cardiac issues, or children. Caution the patient against orthostatic hypotension. Primarily, it's better to administer it at bedtime to minimize the likelihood of orthostatic changes. Institute fall precautions. Certainly, if they're in the hospital or at home, they need to be aware that they may wake up to go to the bathroom and be off balance. So they need to learn to sit on the side of the bed for a couple of minutes and then stand for a minute or so prior to taking off to go to the bathroom or whatever. They need to avoid alcohol and other sedating meds to minimize enhancing sedation. So if someone was on other medications that may also have the potential to cause sedation, then that may enhance the potential risk for falls for this group of medicines. Remember that when discontinuing the medication, it should not be stopped abruptly, or withdrawal symptoms such as nausea, vomiting, and anxiety certainly may be experienced. Assess the complete blood count, because this group of medicines may cause leukopenia, which means low white blood cell count, putting the patient at risk for infection. Also thrombocytopenia, which means low platelets, which would put them at risk for bleeding. And then agranulocytosis, which means an insufficient amount of a specific type of white blood cell called neutrophils. Neutrophils are a particular type of white blood cell that primarily battle against bacterial infections. So we would want to pay particular attention to their white blood cell count total and the different types of white blood cells that they may have. So that completes the tricyclic section. We're going to move on to anti-anxiety drugs, which the examples that we're going to include are benzodiazepines, Buspar, antidepressants, and beta blockers. We've just talked about antidepressants, so I'm not going to spend any more time on that. Beta blockers we will talk about in a different section, so I'm really not going to spend much time on that as well. So benzodiazepines primarily is what we're going to talk about. The examples are lorazepam or Ativan, diazepam, Valium, or alprazolam, Xanax. There are certainly a number of other benzodiazepines that are utilized, but these are ones that you would more likely run into in an average setting. Primarily it's used to treat short-term anxiety and insomnia. It is also used for immediate control of status epilepticus. Remember, we talked about that in a previous lecture. A seizure that's lasting greater than or equal to 20 minutes may need a short-term dosing of Valium, is usually the drug of choice, or Ativan, to get control of that seizure, and then other anti-seizure medications are utilized at that point. So benzodiazepines also induces sedation and causes sleep, and at higher doses, and certain other benzodiazepines are used to help achieve anesthesia for surgeries and procedures. The way that benzodiazepines work in the body is that they enhance the effect of a certain neurotransmitter called GABA, which stands for gamma-aminobutyric acid. That's a particular type of neurotransmitter in the brain and nervous system that is called an inhibitory neurotransmitter. It exerts a calming effect on the central nervous system. So obviously that's why it's a good choice for anxiety. The problem with this class of medications is that people develop tolerance, meaning that it takes more and more of the medication to achieve the same effect if it's continually used. It's a medication that is at high risk for being abused or developing an addiction. And because of that, also, it cannot be stopped suddenly. Stopping it suddenly can induce seizures and severe life-threatening effects. So if someone has been taking it regularly for a good period of time, they should not stop it suddenly. The side effects of benzodiazepines, as you can imagine, with the enhancement of this calming effect on the brain, is drowsiness, lethargy, respiratory depression, and decreased blood pressure. Those are your highest risks, as well as the physical and psychological dependence. And because of the drowsiness and lethargy, it may also cause a person to be at risk for falls. So the interventions for this class of medications is to assess for what it's being given for. Is it working? Is it reducing anxiety? What is the patient's mood? Are they having suicidal thoughts? If they were having seizure activity, and that's why it's being given, then are they having any seizure activity? If it's being given to induce sedation, are they sleeping? Based on what they're taking it for. Assess the vital signs, particularly blood pressure and respirations. And of course, if the respirations were 8 or less, you would hold it. If the blood pressure was 90 systolic or less, you would hold the medication. You want to assess level of consciousness. That's what LOC stands for. And also fall risk. Educate the patient about the risk for developing a tolerance with continued use, and also the risk of abuse and addiction. Advise the patient to avoid use of other sedating meds and certainly alcohol with these medications. Certainly we have to be aware ourselves of other medications that the patient may have ordered in the hospital setting, such as pain medications or even sleeping pills that may also cause sedation. Avoid operating heavy machinery, driving while under the influence of these drugs. We're going to, I didn't specifically talk about Buspar. Buspar is also an anti-anxiety medication. It is much less likely to cause addiction. It is not as useful for immediate relief of anxiety. It takes a certain level of the medication to reach a steady state before it can help with that, but it's much safer in terms of less likely to affect respirations, less likely to cause hypotension, certainly less likely to cause any type of addiction or tolerance. And so for that reason, it is a medication that can be used on a regular basis for a prolonged period of time for anxiety. Now we're going to move to anti-manic drugs, or also called mood stabilizer. The examples are lithium, which stands out by itself, anticonvulsants, Depakote, Lamictal, and Tegretol, which we've talked about previously, so I'm not going to really talk about those, but they do have a mood stabilizing effect because they do affect the neurotransmitters in the brain and keep moods from fluctuating low and high. Also, a couple of particular antipsychotics, which we'll talk about a little bit later, Zyprexa and Clozaril, are also used as mood stabilizers. I want to talk about lithium. Lithium's been around a very long time, and and it's used to stabilize mood swings. It has a calming effect on the brain and the brain activity without actually impairing intellectual activity. So a patient is able to go on and carry out normal activities, go to school, work, etc. And it controls that flight of ideas and hyperactivity and pressured speech and those kinds of things that go along with manic behavior. However, lithium is one of those drugs that has a very narrow therapeutic range, so drug levels have to be monitored closely to make sure that the patient is getting enough but not too much to cause toxic symptoms. The effective therapeutic range, and you're going to want to make sure that you know this for your test, is 0.5 to 1.5 milliequivalents per liter of blood. So that's the range that you're going to want to evaluate periodically to make sure that the patient is taking the medication right, is absorbing it correctly, and is not getting too much. If the levels go above greater than 1.5, those are considered toxic, and so we would certainly want to take action in notifying physicians and potentially holding the medications if we noted a blood test, showing an elevated level. However, we have to always think about when was that blood test drawn. It should be drawn just before the next dose of medication is due so that we see what the levels are, because we want to maintain a certain level. Immediately after we take the medication, within an hour or two, the levels may go up, but then begin to come down. So we have to think about that as well. Lithium depletes the serum sodium, so it causes your body to excrete sodium, and with that goes water, and so the patient is much more susceptible to dehydration who is taking lithium. So patients should be advised to drink 1 to 2 liters of fluid per day. Not all, doesn't have to be all water, but some of it should be water. And particularly they need to be aware if they are being exposed to hot conditions. So for example, if they are employed outside or if they are involved in recreational activities that are outside, they would need to make sure that they consciously increase their fluid intake. And if they come into a situation where they are not drinking enough fluids, they are at much greater risk of becoming toxic on the medication. And for example, if they were to get a stomach bug and be having diarrhea or vomiting, they certainly have a greater risk of becoming toxic at that time. The interventions for lithium, of course, is assess mood, suicidal thoughts, assess their behavior, their affect. Does it match their mood? Are they hyperactive, or are they laying on the bed and won't get up? What is their activity level? And then we want to assess for signs of lithium toxicity, which are listed here: diarrhea, dizziness, nausea, stomach pains, vomiting, weakness, incoordination of arms and legs, which is also called ataxia, muscle twitches, seizures. Is certainly a severe potential side effect of lithium toxicity. We also need to make sure that we assess the liver function and kidney functions with those labs, because we want to make sure that the patient is able to process their lithium and excrete it appropriately. We want to look at their urine output, because we want to make sure they're adequately hydrated and not getting rid of too much urine and not putting back enough fluid. Because non-steroidal anti-inflammatories can also affect sodium levels, you don't want to have a patient taking non-steroidal anti-inflammatories like Motrin or ibuprofen, those naproxen or naproxen, on a regular basis along with the lithium. Occasionally it should not affect it. If the patient for some reason was taking lithium on a regular basis and was prescribed a diuretic, they are going to be much more susceptible to dehydration. Much more close attention needs to be paid attention to their blood pressure, their urine output, those signs and symptoms, as well as their lithium levels. Lithium certainly may cause birth defects. It's called teratogenic. So women that are of childbearing age and on lithium should continuously use an effective method of birth control. Antipsychotics is the next class that we're going to talk about. And there are typical antipsychotics, which include Haldol, Prolixin, and Thorazine. Haldol is probably the one that you might see utilized in this day and age. And then atypical antipsychotics, which are listed here. The atypical antipsychotics are used more commonly now because they have less potential side effects in some regards. And with psychosis, which means losing touch sort of with reality, a patient can have positive symptoms or negative symptoms. Let me explain that. Positive symptoms of psychosis means that they have either hallucinations, delusions, or paranoia. Those are called positive symptoms of psychosis. So I think that sometimes that can be misleading. When we think about positive, we think about good. Obviously, those symptoms are not good. But these are symptoms that are definitely related. These are things that are not normally present in a person. And so if present, that means they're positive, sort of like having a strep test that's positive. Well, that means you have strep throat. It's not a good thing, but you have it. The test result is positive. Being pregnant, the test result is positive. For some people that's good, and for some people that's not. So anyway, the positive symptoms for psychosis are hallucinations, delusions, and paranoia. So the typical antipsychotics definitely help with those positive symptoms. Negative symptoms that are associated with psychosis are lack of motivation, poverty of speech, meaning not somebody who's going to be very verbal, responding in monosyllable tones and words, not engaging in much conversation, being withdrawn socially, lack of motivation, lack of activity, those things. So the typical antipsychotics, Haldol, etc., help reduce the positive symptoms. So they're less likely to have hallucinations, delusions, and paranoia. But it doesn't do a whole lot to motivate them, increase their activity, their attendance, to their appearance and taking baths and things like that. The atypical antipsychotics do both. So they help to reduce the positive symptoms, the hallucinations, delusions, and paranoia, while at the same time helping to improve their mood, helping them to be more active, to have more motivation, to be more social, to take care of their appearance more, etc. The way that these medications work is that they block the actions of dopamine in the central nervous system. And so that's their actual effect in the brain. The potential side effects of this medication can be found on page 383 of your key text and include a couple of things. Extrapyramidal symptoms, which is also called pseudo-Parkinsonism. I see another spelling error, which drives me crazy. But anyway, we've had some conversations previously in another module about Parkinson's disease and what that looks like. And so these medications can make a person have the symptoms as if they are exhibiting signs and symptoms of Parkinson's disease, which includes the stooped posture, the rigidity, tremors at rest, a mask-like face, bradykinesia or slow movement. All of those things are things that are associated with Parkinson's disease because it is affecting the dopamine levels. A couple of specific things: acute dystonia, which is muscle spasms of the face, tongue, neck, back, facial grimacing, possibly even spasms of the laryngeal muscles that might impair your ability to breathe, can all occur. Pretty much that occurs, generally speaking, soon after the first dose or an increase in dose of these medications. And the treatment is usually an anti-Parkinson's medication like cogentin, and we have talked about that in a previous module. Another potential side effect is called akathisia, which is restlessness, an inability to stand still. They pace, they have trouble sitting down and trouble standing still. They're just like the Energizer Bunny, constantly on the move, and it's disturbing to them as well as to those around them. And so these are potential side effects of the antipsychotics, all of them. Neuroleptic malignant syndrome also is a potential side effect. We've talked about the signs and symptoms of that. Orthostatic hypotension is a significant potential side effect. Drowsiness, of course, although the drowsiness, once they've been taking it for several days or evenings, that seems to get better. It's advised to be taken at bedtime so that you can minimize the effect of the drowsiness and or actually use it to your advantage. If they're having trouble sleeping, then it will help with that. Anticholinergic side effects like dry mouth, increased heart rate, urinary retention, and constipation are also something that can be experienced with these class of drugs. Primarily, those things that we just talked about are related to the typical antipsychotics, the Haldol, Thorazine, Prolixin. The atypical antipsychotics, these examples, Risperdal, Zyprexa, Geodon, Seroquel, and Abilify. Again, it treats both the positive and the negative symptoms of psychosis. But the side effects can include significant weight gain, which then impairs the patient's ability to utilize insulin. They become insulin resistant and even can develop true diabetes. So while they are taking these medications, it has to be closely followed, their blood sugars, their hemoglobin A1Cs, and also educating them about portion control, minimizing high carb diets, that kind of thing. Sexual dysfunction is something that is fairly common with this class of medicines as well, and certainly can interfere with a patient's life and needs to be addressed and asked about in our assessments. Orthostatic hypotension, another potential side effect. Clozaril is another atypical antidepressant that I chose to talk about specifically because it has a couple of unique features. It's a very effective medication, but it has a risk of two very serious side effects. So it's usually reserved for patients that don't respond to other medications, and it can only be given to patients who are going to be available for close follow-up, who either from their family or they're in a facility where they can be monitored closely. This medication doesn't really cause those extrapyramidal side effects, but it can cause seizures and agranulocytosis. And if you remember, the agranulocytosis means that the body does not produce enough of a specific white blood cell called neutrophils that fight bacterial infections. We are exposed to bacteria all the time, in our intestines, on the surface of our skin, etc. And with a normally functioning immune system, we do not get bacterial infections. But if something causes our immune system not to function well, we will get infections that should not generally happen. So the WBCs in a patient taking Clozaril are monitored usually weekly at first and then every 2 weeks. If the white blood cell count total falls below 3,000, then the medication has to be discontinued, as this places the patient at greater risk for infection. So the interventions for antipsychotics would be assessing their mood, suicidal thoughts, thoughts of harming others, assess for those positive symptoms of psychosis, hallucinations, delusions, paranoia, assess for the negative symptoms, the motivation, their speech, their attention to their appearance, performing ADLs like showering and dressing appropriately, and any socialization activities. And assess for side effects such as orthostatic hypotension, the neuroleptic malignant syndrome, those extrapyramidal symptoms that we mentioned, the acute dystonia, the akathisia, that restlessness. Monitor their weight, encourage balanced meals, and lower carb diets. And that pretty much takes us through all of the psychiatric medications that you would have covered in your book and in your tutorial. I will be making another review for the Module 8 anti-infectives, so you'll look for that as well.